Hi everybody, and welcome to our webinar on the Bachelor of Nursing through WSU Online. My name's Dr. Cathy Dickson and I'm here with my colleague Chelsea.
Hi everyone.
And Kath, who's
Hi,
going to
everyone.
take some questions from you today. And then we're going to answer some of the frequently asked questions about the Bachelor of Nursing Online, and then answer some of your questions during the session and at the end of the session. So thank you so much for coming. We know that you're very busy people and you're probably in the middle of lunch at work. So thanks so much for attending today.
So we'll just quickly cover what we're going to be going through today. So we'll give you guys a little bit of an overview about Western Sydney University Online and in particular the Bachelor of Nursing Online and how it all works. We'll be going through the professional practice experience units and how they will work, and then Cathy will run through some career outcomes as well with the Bachelor of Nursing. We will have dedicated time at the end for questions. So you'll notice at the bottom of your screen there's a little Q&A button, so you're able to type in questions and our colleague Kath will be able to send those through to us. However, if you do have questions throughout the presentation, just feel free to send those through. But as I said, we will have the dedicated time at the end, so don't stress if we don't get to them during the presentation.
Okay, so that's exactly right. Thanks, Chelsea. And if you do have any questions, please use the Q&A box you can see down there on your screen. So that'd be great. Okay, so a little bit about Western Sydney University Online Bachelor of Nursing. So the course that Western Sydney Online offers has an excellent reputation across Australia and internationally. And the course that we offer is one of the top ranking courses in Australia. And Western Sydney University is ranked up in the 2% of Australian universities. So we have a great reputation and a terrific course. Our School of Nursing Midwifery is well known throughout Australia and has a terrific reputation for graduates, especially in the clinical environment. So you'll be studying with a really fantastic university. What we like to do at WSU Online is really make sure that we help our students succeed the best way we can. And we like to organise our online learning in a way that will help you to achieve success. So what we're doing is that we're very conscious of our students. We know that they're very busy people with lives and families and other work commitments as well most of the time. So we really pay attention to that and work with you to help you achieve your goals and becoming a registered nurse. So that's why we're here, to get you across the line and make sure that you get the chance to succeed in that career goal. So the course that you're going to be doing or that you're interested in doing is delivered in a reduced study load, and that helps you be able to manage your study as well as all those other really important things that you have in your life that we've already mentioned. Recognise our students, still have full-time jobs, and we really want our structure of our course to be able to fit into that with what you're doing in your the rest of your adult life. Students who've already begun our BN are so grateful that they have the opportunity to study online because it is working out really well for them and fitting in with their family commitments and their work commitments. I know I keep saying that, but it's really important because we understand that that's our group of students that we're catering towards. Yeah. So the units you study are no different to the on-campus cohorts, so your fellow colleagues in the Bachelor of Nursing through the on-campus mode. They're exactly the same. And our course leads to your ability to apply to become a registered nurse at the end of the 4 years, just like the on-campus course does. So there's no difference in what you'll be studying theoretically and in your clinical skills units and your clinical practice units.
And just on that, I think it's worth noting as well, one question we get a lot is, will my degree say that it was done online? And the answer is no, it'll just be issued from Western Sydney University.
Okay.
So there really is no difference in terms of what qualification you're getting at the end.
That's a great question. Yeah, thanks for raising that, Chelsea. So what I'd really like Chelsea to explain to you now or go through is a lot of the really frequently asked questions that we get. So so Chelsea, as part of your role, you get lots of students calling in and asking questions. So
absolutely. So probably the main thing I just want to touch on as well is just with our 7-day week support. So
good idea. Yeah,
it's something that it's quite unique to Western Sydney Online. So we offer the 7-day week support, as I mentioned. So you have the student advisors. They're the ones that are available 7 days a week to you throughout your studies. So they're available Monday to Friday, 8 AM till 9 PM. And on the weekends, they're also available 10 till 6. So they're there for all of your sort of general queries if you're having trouble logging in, submitting an assignment, all of those sorts of day-to-day issues. So you can either give them a call or you can email them. And you also have an online learning advisor, or OLA. They're essentially your online tutor for each unit that you're enrolled into. So they'll be there to obviously oversee your unit. But if you're having specific questions relating directly to your assignment, you can contact them, and they're more than happy to help you as well.
It's so good to have the weekend coverage too, Chelsea.
Yep.
That's so important, isn't it?
Yeah, and most public holidays as well.
Yep.
So there's always someone there, even if you're emailing outside of those hours, they will get back to you pretty quickly. It's a really great resource to have.
Awesome. Okay.
So we'll go through some of the, I suppose, main points of how the whole course works online. This is the number one question, is people give us a call and go, how does it all work? So as you mentioned, it's a reduced load. So it takes you 4 years to complete the course. So we have a trimester system with online, which means you'll be doing 3 teaching periods per year. So they start in February, June and September. And each teaching period runs for 11 weeks. So during each teaching period, it's, as I said, a set program. So you're doing 2 units at a time, 6 units a year, which equates to 4 years in total. So how it works with the course breakdown, I suppose, is of the 24 units overall, 18 of these are theory-based, so they're all done online unless the unit has an exam, in which case you do sit the exam in person. However, we have exam venues all around Australia, so you don't need to stress about that. In terms of the remaining 6 units, these are what are called your professional practice experience units, or pracs, as we would call them. So the way that pracs work is you have on-campus residentials, and you also have clinical placements. So we'll just get the slide up where we break that down a little bit for you so you can have a look. So if of the first prac you'll be doing, as you can see in this table, your PPE 1 just has 5 days spent on campus doing your residentials or labs, and doesn't have any clinical placement coupled with that. So that's just your first one, and then going forward from there, your remaining 5 prac units all have labs or residential days on campus and clinical placement days as well. So your labs on campus or residentials can be done at a number of different Western Sydney campuses, so you'd be allocated to one that has the nursing facilities. And then in terms of your clinical placements, they can be done in any community care or hospital, and they're actually organised by a dedicated clinical placements team on campus. So they'll try to place you as close as possible to where you live.
Yeah, and that's a really good point, Chelsea, because we have students who are all from all states in Australia studying the Bachelor of Nursing Online. So it doesn't matter that you're not in New South Wales or Victoria, or, we can place anywhere across Australia. So it's really open to all students everywhere to be able to study their nursing degree online. So that's, a great point.
Yep, so that's right. So clinical placements can be done anywhere in Australia. It is worth noting that if you do reside outside of New South Wales, you will be required to travel to one of the Western Sydney campuses for your residential days. So that's a total of 21 days throughout the 4 years. So your residential days range from 2 to 5 consecutive days. So we usually, where possible, try to run them over a weekend as well. So you'd be doing, say, 9 to 5, maybe Wednesday to Sunday. That's an example of the first one. But it is just 21 days over the 4 years. But yeah, the clinical placements definitely can be arranged in your state.
That's right. So what's next?
To run through some of the career outcomes of the
Oh, okay.
Take us through.
Yes. So at the end of your degree, you'll be able to apply to become registered as a registered nurse through AHPRA and the Nursing and Midwives Board of Australia. So the course is accredited by both of those organisations to allow our graduates to be able to apply to become a registered nurse at the end of it. So because we don't have any huge exams anymore set by the Nurses and Midwives Board of Australia, the universities just look after their own sets of students, and we run our own exams to finish your degree. Then you need to apply to become a registered nurse through AHPRA, the Australian Health Practitioners Registration Authority. So our course enables you to do that. And some of the career outcomes, what's just popped into my mind, Chelsea, is one of the recent students that I've worked with, and the student I'd like to really talk to you about is a mum of 3 boys, and she's from Sydney, and she was very successful in managing her family and her studies, and then was able to graduate successfully and won quite a number of awards with the university, even though she was a mum and had some other work to do as well besides being a mum and looking after the family. And she's got a really great graduate position at Westmead Hospital in Sydney. So the point I'm getting at by saying that is when you've finished your degree and you've registered as a registered nurse, there are a number of new graduate programs that some of the large health facilities run. So the big tertiary hospitals will run a new graduate position which you need to apply. But a number of our students at Western Chelsea are really successful in getting new graduate programs and getting jobs straight after they've graduated. So we have a really great success rate around that. And when you apply and are successful in a new graduate program, they rotate you through different areas of the hospital. So this particular student that I was talking about, she's going to 4 different areas in the hospital, and she loves midwifery care. So she's been able to choose an elective in that rotation to go to the postnatal ward and look after mums and bubs. She's also been to intensive care, to a cardiac step-down ward and a medical ward in her new graduate rotation. So that's really important, that if you can get a new graduate rotation, that would be fantastic. But some students aren't successful in getting a new graduate rotation. So therefore they're wondering, where do I go from here? But let me tell you, Chelsea, there's some insider information that's really good to know, that aged care is a super career move, and that we all know that our population is getting older and we need fantastic registered nurses in the aged care sector as well. So there's a lot of support for new graduate nurses to work in the aged care sector. So I would really, encourage our graduates to think not only about the acute care sector and what's available there, but also in the aged care sector to look after our ageing population. Great career structure there and great career move as well.
Yeah, absolutely.
That's awesome.
And I think it's great that you mentioned that student that you had being a working mum. Most of our inquiries do come from working mums.
Yeah.
And that's probably one of the main reasons that we offer this course in a reduced load. It will set you up for the best success. So statistically, we find that students who just study 2 units each trimester have the best study outcomes. So it is setting you up for success. Just taking that extra little bit of time studying it online in a reduced load is going to help you balance your work life as well.
I'm really glad that you brought that up too, because we have a lot of students who are changing careers.
Yeah.
So the current cohorts of students, we have people who are moving over from the ambulance sector, from the police force, from the sales workforce sector, retail, people who've got such varied careers, coming to study their lifelong dream to become a registered nurse. So really, it's a fantastic way to be able to reach that goal, to be able to do it online and still manage all those other things.
Yeah, absolutely. One thing I hear a lot every day, when people call in is, I'm too old to study, I'm 40 years old, I'm a mum, all of this. But I suppose you have to keep in mind, the average age of retirement these days is just getting older and older. So it's a long time to be in a career that you don't want to if you keep putting it off. So you're not too old, and there's a lot of other people in the same boat. So,
Absolutely.
Yeah, that's exactly why we have this program.
Yeah, and we have gentlemen in the course too, lots of young men and dads as well that have always wanted to become a registered nurse. So the course really is open to anyone and really supports anybody who wants to make the career move into the great profession of nursing. So
absolutely.
Awesome, come on, join us.
Yeah.
So have we got some questions, Kat?
We do have some questions coming through. Thank you everyone for your questions. First question is, I have a newborn at home, 9 weeks old. During residentials, I actually live in Penrith. Would I be able to live at home during those residentials rather than attend elsewhere?
Yep.
Yeah. We do have facilities at Penrith. Unfortunately, the residentials or labs aren't offered, say, at Penrith every single time. So potentially you may have some at Penrith, but at other times you may have to go to Campbelltown or Hawkesbury or Parramatta. So you do have to keep that in mind. Again, they are just those short 2 to 5 days. I know that's hard when you have a newborn or a family, but they can be at varied locations. So we couldn't just specifically put you at 1, I'm afraid. You would need to be prepared to travel.
And, if you were breastfeeding your baby, if you could have a family member, bring the baby down for, feeds and that sort of thing. We're very supportive of that as well. But residentials are compulsory, and you've got to attend the number of days that are in the unit.
Yes, that's correct.
Yeah.
Cool. Next question is, what are the prerequisites to study the course? I'm an assistant nurse with Cert 3 and Cert 4 qualifications along with an associate degree.
Wow, that's some great qualifications there.
And that's a great question. So entry criteria is, the next biggest question we get daily, am I eligible? There's a whole range of different things we can accept for entry. So I wouldn't just give a blanket answer on yes. Generally with a Cert 3 or Cert 4, we're looking for some work experience as well. So 2 years, and it doesn't necessarily need to be in a health services role, although that is highly regarded. But what I would recommend is getting in contact with my team, the course consultants, and we would be able to help you to sort of figure out. We need to see your resume to assess that. In terms of an associate degree, that would generally grant you direct entry into a course that would sort of be considered similar to a diploma. So a diploma, for example, does grant you direct entry alone, so we can sort of guarantee that. But always just refer back to our entry criteria table on our website, or give us a call, as I said, and we'll be able to discuss your personal situation in regards to entry criteria.
Absolutely. Yeah, that's great.
Yeah. Great. Next question from David. What about RPL from Even?
Okay, not too sure that's...
We do grant RPL.
Yeah,
absolutely. So we absolutely do. So what we would need, if you've studied another course at university, or you have a diploma in nursing from a TAFE or a registered education provider, then we would definitely look at what you've done and compare it to what we need on campus. So we do grant RPL, and it's based on the information that you send us about what you studied previously.
Yeah, and I can see in a couple of the upcoming questions that's coming up a fair bit about the Diploma of Nursing. It is probably worth mentioning the Diploma of Nursing, especially studied through TAFE New South Wales, does grant you the first 8 units.
So it's the first year, so that's pretty great.
So the only, and that's amazing, and it's direct entry, but the only issue with that is our course is fairly new to online. We do only have first year units available at this stage. So if you do have Diploma of Nursing, you will need to hold off until June 2019, when we will have second year units built. So that you'll be able to go straight into sort of second year level units, which is amazing. But at this stage, unfortunately, we wouldn't be able to grant you entry into the course just because they're ready for you.
Because we don't have the units ready just yet. So
that's right.
That's because we're a brand new rollout of the online course.
Yeah. I can see another question here about being an enrolled nurse with 15 years of experience.
Wow, that's great.
At this stage, it would need to be a current Diploma of Nursing to be granted any credit, or previously studied university units in nursing to grant credit. So work experience alone, we aren't able to grant credit. However, it would contribute towards your entry criteria.
Absolutely.
We've also had another question come through about PPE. So Kira has said, in commencing in trimester 2, will we start with the trimester 1 units of primary healthcare and PPE 1, or slot into the already running course of trimester 2 units?
Okay, that's a really great question. So what we're doing at the moment is running the NMAC approved course structure. So you would actually come into teaching period 2 and study professional communication and primary healthcare. So then you would do the bioscience 1 and PPE in the next teaching period.
Teaching period 3. So you wouldn't be joining the people who have already started. You'd essentially be starting the course fresh.
As a new group.
As a new group. That's right.
Someone's just asked a question. They've already started studying through CQU, and then would there be any potential credits there if they've studied with them?
Great question. Do you want to answer that?
So again, that would be one for my team, the course consultants, and actually would eventually go through you, Cathy.
That's right.
So we would assess your transcripts and have a look at what sort of units you've completed, and Western Sydney have a process, I suppose, of matching up units to see if they're an equivalent in which we could grant you credit. So you would need to make an application or contact a course consultant, and we would receive your transcripts, and that's how we would start that process for you.
Absolutely.
There's also a similar question that's come through, someone who's actually studying on campus and they want to move to online. Is that possible?
Yes.
It is possible, but what you need to do is actually unenroll. from the on-campus course and then re-enroll online. So there isn't a direct transfer process, but that by all means, that's absolutely doable. You just need to unenroll from the Bachelor of Nursing on campus and re-enroll online.
Yeah, and again, get in contact with the course consultants before you do that, so that we can just make sure you are eligible to enrol with online, and make sure that's all going to go through before you withdraw from your on-campus course.
Yeah.
So that we can, organise
because
that
it depends on
process.
how many units and stuff you've done too.
Yeah, so if you've already completed the first year of nursing on campus, again, that's going to be the same issue as those who have a diploma. We don't have any second year units for you to go into just yet.
Yeah.
There's been another question come through about placements. Can we request placements at a larger hospital than the one closest to me?
That is such a good point. Thank you so much for bringing that up. The clinical placement team, and we have a dedicated clinical placement team at Western Sydney University School of Nursing and Midwifery, and they have a system where you can actually choose, well not choose, you can put in 3 preferences. So you can't choose where we place you, but you can put in preferences, and the highest preference down to the lowest preference. And we try really hard to get you a placement that you've actually put in your preferences. You might not get always your first preference; it might be the second or third, but you have to, think about that and just, be, I suppose, a little bit flexible around that, because we have so many students in nursing looking for placements, and we're not the only university around in some particular areas. We're competing with other universities, so that's why we ask you to put in a couple of preferences where you'd like to go, but we try really hard to place you within an hour's drive of where you actually live, or of your postcode, so that we put a lot of effort into that and making sure that we can get you a placement that you would prefer to go to. Yeah.
Great question. Another one here. Can we do more units per session?
Yeah, that's a question we get daily as well. So unfortunately, it is a set 4-year program. So a couple of reasons for that, but it is just the way it is at this stage with the course. Again, the course is brand new, so sort of just testing waters, I suppose, with that. But at this stage, it is just the 2 units each teaching period, so you can't reduce that and you can't add any more. I'm afraid it would just be set to the 4 years.
Yeah, because that's the course that's been approved by the accreditation body, the Australian Nurses and Midwifery Council. So, unfortunately not just now, sorry.
Final few questions. One about placement. Can they hold their placement at the place they currently work at the hospitals?
We can negotiate with you around that. I think it's really important to consider the type of experience that you're going to get if you're known in the place that you work. Like, even if you work in a big hospital, people know you in different wards and that sort of thing. So what we want our students to have is the student experience. So we want you to be able to go somewhere and just be the student, and be able to absorb and learn nursing at your own pace, even though there are skills and competencies that you need to get done. But we find sometimes that if students go to a place where they work, then people know them and expect more of them than what they would do, because you already know everything. Oh, Chelsea, would you mind doing this for me? You know where that is, and ask more of you than the student experience. So we would have to have a talk to you about that. The clinical placement team will definitely have a dialogue around that with you and see, what sort of place you're working at, and is it big enough that you would really get, a really good student experience.
Another question from Clara. Can we attend a campus to speak with someone and access the library resources if we wanted to? Do we speak to the same people who do on-campus teaching?
It's a really good question. So there's a bit of yes and no in that one. So you're definitely welcome to use the on-campus facilities. So you can attend and use the library, not a problem. You would also be able to request a student card, which is another question that pops up quite frequently. In terms of speaking to the same people who do on-campus teaching, your OLA is specifically designed for they've only
chosen for online,
online learning. So they don't necessarily work on campus. So it's good to keep that in mind. They would be your point of contact. So generally you would contact them via email. Often OLAs, I know, are quite generous with their time and happy to have a phone call with a student. So if you're really struggling, it's good to keep that in mind. But definitely you can attend campus for some things. But in terms of attending lectures and tutorials, people do often ask that as well. Unfortunately not. You have to keep in mind we run on a separate schedule to on campus.
That's right. We're in a trimester, not a semester.
So your learning wouldn't even correlate with what they're studying on campus, someone at the same level as you. So it's completely separate, but obviously derived directly from on campus, all of your learnings.
Yeah, and our teaching teams are separate. So there's the on-campus staff and there's online staff, because where our staff go through a number of processes to make sure that they understand the specific learning needs of students online. So, you know, they've been trained in that, and to be able to, you know, to work with you and appreciate where you're coming from, you know, being an online student, because it is quite a different experience than being in the on-campus environment.
Absolutely.
Yeah.
Another great question from Miriam. What kind of online community surrounds the course? Will we have chances to interact with other students?
Oh, wow, that's a great question. Yeah. So at the moment, there's students are setting up Facebook groups, and we're looking at doing that as well to support our students. There's definitely a very healthy community of students and a community within the Western Sydney Online as well. So you get lots of communication from WSU Online, you know, making sure that, you know, you're happy with what's going on. We touch base with you quite frequently. We call it a high touch model here at WSU Online. So you get lots of support, lots of contact from people making sure that everything's going okay. I see you've submitted this assignment but not that assignment. Do you need any extra help? All of that sort of stuff. So yeah. And we encourage students to talk, you know, amongst themselves, and we're developing specific groups around that as well. So absolutely great community of online students.
Another question from Miriam. I'm not sure if you'll know this, Cathy, but she's just wondering if there is a campus childcare available when she has to go on campus.
Okay, there is campus childcare on some of the campuses. Not all of the campuses have that. So what you might need to do is ring up a particular campus and say, look, you know, when I come to residential, is there, you know, childcare available? And, you know, would there be places available at a particular time? So they do make places available for students that sort of come on an irregular basis. So we'll be best probably contacting a student services on the campus, you know, that you're going to have your residential app and see that if they've got any child mining facilities there.
Definitely.
So I think that's about time. We've answered a lot of questions. Thank you all for your questions.
I can see a couple of people may have joined late there. Just be aware that we will be sending you this recording via email afterwards, so feel free to watch back. Even if there's a couple of things you've forgotten and you want to watch that back. As we mentioned, it's best to contact the course consultants in regards to any questions you have about entry criteria, RPL, or even just any further questions that weren't answered today. So our number's up on the screen at the moment, but it is also on our website as well. So we'll be emailing you out a fair bit of information after this webinar, so don't be afraid to get in touch.
That's right, and let us know if you enjoyed the webinar. It's great. It was, you know, really lovely seeing all your questions and being able to connect with you in this way. So hopefully, you know, we will run some more of them.
Absolutely.
We got some great feedback from you.
Just before we do finish things up, I did just want to mention that there are limited places for nursing. So we're currently accepting enrolments for our June intake. So that begins on June 11th, which is teaching period 2. If you are looking to apply for that intake, I do recommend doing so fairly soon. I would imagine the places will fill out within the next 5 to 6 weeks, just based on where we are with numbers at the moment. So it is worthwhile getting in contact with us, putting in an application or giving us a call, just so that you don't miss out on your spot.
Great point. All right. Okay, well, thank you so much for joining us today, and hopefully we'll see you in the course.
Thanks, everyone.
Thanks a lot.